Hey guys, I'm Yogita Modi, a second year MBBS student. Today we will discuss on vascular hypertensive disease. Basically, we will read about hypertension. Okay, so I will give you the brief about the topic and how many parts we will cover it. So I'll cover this video in two parts. In first part, I'll discuss on definition, type of the hypertension, causes, pathogenesis, consequences of the hypertension. Okay. In the second part, we will discuss morphology of the vascular changes. Basically, in the hypertension, the vascular changes occur. Okay. Then, renal changes in the hypertension and what are the role of the renal system in the maintenance of the hypertension and how the renal system affected by the hypertension. Okay. So the WHO definition says okay. Now discuss type of the hypertension. There is a two type of the hypertension. First is a primary hypertension. Second is a secondary hypertension. Primary hypertension is also called as essential hypertension or idiopathic hypertension. Okay. Also called as essential hypertension. Okay. Now secondary hypertension is secondary hypertension. Now second is secondary hypertension. Okay. Now we'll discuss cause of the hypertension. Okay. Firstly discuss primary hypertension, then secondary. Okay. So the primary hypertension is a present 95% in all the disease. That's why it is called as essential hypertension or idiopathic hypertension because we don't know what is the pathology, what is the exact pathology behind this. Okay. So this is present in all the disease like about 90% in all cases. Right? Now come on the secondary hypertension. Why we are calling this is the secondary hypertension? Because the disease is related to the other system that is causing hypertension also. Okay, so this is called as so that's why we call it is a secondary hypertension. Okay, so what are the cause behind the secondary hypertension? There can be the renal cause, there can be the cardiovascular system pathology, there can be the endocrine pathology, neurological disorder. Okay, so we'll write renal cause. Okay, what is the renal cause? Acute glomerulonephritis. This is a bacterial infection which is causing the hypertension. Polycystic diseases. Okay, renal arterial stenosis. Then renin producing cell tumor. Chronic renal disease. Okay, we will discuss how these all renal cause is responsible for the hypertension in the pathologic portion. Okay, now on cardiovascular system diseases. Okay, it is caused by the coarctation of the aorta. Okay, and other congenital heart diseases, thrombosis, stenosis. Okay, coronary artery disease, thrombosis. Okay. Then discuss on endocrine cause. Adrenal gland disorder, pheochromocytoma, hyperthyroidism, hyperparathyroidism, pregnancy-induced hypertension, oral contraceptive pills, tyramine-containing food. Okay, all these are responsible for the hypertension. Hypertension. Okay, then come on neurological cause. It can be sleep apnea, increased intracranial pressure, okay, and acute stress, Okay, now come on the pathogenesis. So pathogenesis we will discuss in two parts: idiopathic hypertension pathogenesis and secondary hypertension pathogenesis. Okay, so the pathogenesis of the idiopathic hypertension is very complex and multifactorial disease. Okay, because we don't know what is the exact cause of this. What are the factors mainly responsible for this hypertension? Okay, so this is the complex and multifactorial disease. Okay, it can cause by decreased renal sodium excretion, water excretion, rise vascular resistance, genetic factor and environmental factor. Okay, so decreased renal sodium excretion, rise vascular resistance, genetic factor, genetic factor like mutation in the enzyme protein that is responsible for the sodium and water excretion and absorption. Okay, enzyme responsible for the aldosterone metabolism. Like mutation in the epithelium sodium channel, mutation in the gene code for epithelium sodium channel. Okay, then environmental factor. Environmental factor can be obesity, it can be smoking, alcoholism, okay, physical activity and high salt consumption, less physical activity, and high salt consumption. Okay, now discuss about secondary hypertension pathogenesis, right? renal pathogenesis, there is a renal arterial stenosis, preeclampsia, glomerulonephritis, and polycystic kidney. How these are responsible? So basically, these all conditions decreasing the renal perfusion that cause the decreasing the GFR, glomerular filtration rate. Okay, when the GFR is decreasing, the filtrate amount is also decreasing, that activate the renin angiotensin aldosterone pathway. Okay, so as the renin is activate, the formation of the angiotensinogen to the angiotensin first, and angiotensin first is converted into the angiotensin second, and angiotensin second is a vasoactive hormone that is responsible for the contraction of the smooth muscle and release of the aldosterone from the adrenal gland. Okay, so these both factors responsible for the increasing the blood pressure. Okay, okay. Then second is endocrine pathology. Okay, in endocrine pathology, there will be the primary hyperaldosteronism, hyperparathyroidism, hyperparathyroidism, hyperthyroidism, pheochromocytoma. Okay, these are the responsible for the hypertension. Okay, so in the primary hyperaldosteronism, increasing the aldosterone concentration in the blood, and aldosterone is responsible for the sodium and water retention. Okay, it increasing the renal reabsorption of the sodium and water. In hyperthyroidism, increasing the BMR, increasing the oxygen and metabolic demand of the tissue. Okay, so cardiac output is increasing, cardiac contractility is also increasing. In hyperparathyroidism, increasing the calcium ion concentration in the blood, and calcium ion is responsible for the contraction of the smooth muscle. So it is increasing the peripheral vascular resistance. In pheochromocytoma, there is also increasing the mineralocorticoid and glucocorticoid that is also responsible for the hypertension. Okay, so in this, increasing the okay, increasing the calcium ion concentration, increasing the sodium concentration. Okay, now come on the cardiovascular pathology. In cardiovascular, like coarctation of the aorta, that is responsible for the hypertension because there is a basically narrowing of the lumen of the blood vessels. Okay, as the narrowing of the blood vessel, the peripheral resistance is increasing. So this is causing the hypertension and increasing the contractility and cardiac output of the heart also. So in cardiac, increasing the peripheral vascular resistance that is causing the hypertension. Okay, now come on the consequences of the hypertension. Okay, so the hypertension is a major modified risk factor for the atherosclerosis. So what is the atherosclerosis? There is a deposition of the fatty fibrous capsulated plug in the lumen of the vessels. So that is narrowing the lumen and causing the obstruction. Okay, so the hypertension is a major modifiable. Why it is called as modifiable? Because it can be decreased or increased. Okay, like age. By the old age, the atherosclerosis is common. This is the non-modifiable because we can't change the age. Okay, so this is differentiate between major modifiable and non-modifiable. In modifiable, okay, so we will write, okay, and other disease and lesion which is related to the hypertension, like cardiac hypertrophy, congestive heart failure, ischemic heart disease, aortic dissection, okay, that are the caused by the hypertension. Other than there will be subarachnoid hemorrhage, retinal ischemia or infection, and renal failure. Okay, subarachnoid hemorrhage, then renal infection or ischemia, and retinal ischemia and infection, and failure. Okay, so how this is responsible for the hypertension? Okay, heart muscle is functioning more. Heart is contracting very rapidly and contract force of contraction also increasing, cardiac output is also increased. In this condition, the cardiac muscle is working more. Okay, so this is a physiological condition from the avoid the apoptosis. There is a modifiable pathway. Uh, Follow the path hypertrophy, hyperplasia, dysplasia, or metaplasia. Okay, so in this condition, the cardiac hypertrophy is occurring because the increasing the cardiac workload. Okay, congestive heart failure. What happened in the pulmonary hypertension and the systemic hypertension? The congestive heart failure is present. Congestive heart failure means the heart is functioning more, cardiac hypertrophy, cardiac dilatation. Okay, and it can be caused the thrombosis or embolism also. So in this condition, the pulmonary hypertension causing the right heart failure and the systemic hypertension causing the left heart failure. Okay, pulmonary hypertension and systemic hypertension. So aortic dissection. What is the aortic dissection? So the artery or vessels is made up of three layers, and blood flow in the lumen of the vessels. Okay, so what happened in the dissection? The blood is escaped between the blood vessels layer. Okay, and they are forming a small bulging channel. Okay, so this is called as aortic dissection. Ischemic heart disease is the hypertension. Okay, so it can cause thrombosis or embolism that and causing the ischemia and necrosis. Okay, in the hypertension, subarachnoid hemorrhage. In the subarachnoid hemorrhage, there is a rupture of the blood vessels because the subarachnoid blood capillaries are very thinner. Okay, so in this condition, the rising the intracranial pressure in the hypertension, it causing the rupture of the vessels. Okay, and the retinal ischemia or infraction. We can see ischemia infraction in the eye. Okay, in the renal failure, also occurring in the hypertension because the renal system is a major organ for the regulation of the blood pressure. Okay, so any alteration in the blood pressure, the kidney is working. When the kidneys start more working and releasing of the hormone and other vasoactive substance, it damaging the kidney also. Okay, now come on the there is a one more terminology, malignant hypertension. What happens in the malignant hypertension when the blood pressure is raised above 200 by 120 mm of Hg? Right, we can write raised 120 mm of Hg with renal failure and retinal infection. It can be present with or without papilloedema. What is the papilloedema? I'll show you the picture. This is the papilloedema. You can see this bulging, okay, and redness also. Okay.